Well, hello to everyone. We should start. Well, first of all, thank you so much for joining today's training capsule on transformation of pediatric diabetes management. I'm really thrilled to have two very special professionals today with us. And before to start, let me introduce myself. I am Sofia Ferreira. I'm innovation manager at HJT Barcelona Children's Hospital, and I am part also of the iForKids team, which is a pediatric innovation hub dedicated to boost innovations designed specifically for children. Before we dive into today's content, let me share some guidelines to ensure a smooth session. And the goal is to have an open, engaging discussion with our two participants today over the next 30 and 40 minutes. We welcome your questions via chat, but we will address them all at the end of the session. We also kindly ask everyone to keep their microphones muted, and we would really appreciate if you could have your cameras on to make a more interactive discussion with all. So before starting, we wanted to share that in relation with the topic that we want to discuss today, at HET we are leading a European project focused on optimization of demand-driven financing instruments to improve pediatric innovation across Europe. And to do this, we are developing a European action plan in collaboration with our partners, which are EIT Health, Aquas, Cienciano, Inveniam, ECHO, and the Children's Memorial in Warsaw. Now, with this objective in mind, we thought that the panel today will bring a valuable experience to share with all of you on how we have implemented this new model for care of the diabetes in pediatric patients in our hospital. So with further ado, we can introduce very briefly yourself, please, Roque and Luisa.
I'm Roque Cardona-Hernandez. I'm pediatric endocrinologist and clinical researcher, and I lead the diabetes team at Sant Joan de Déu, which is the largest pediatric diabetes center in Spain. We follow up around 800 children and adolescents with type 1 diabetes, and I've been very lucky to participate in this innovative project aimed to improve the quality of life and the clinical outcomes of children and adolescents with type 1 diabetes.
Thanks, Roque. My name is Luisa Martinez. I'm currently the head of research at the Directorate of Research, Innovation and Learning at Sant Joan de Déu. Over the past 5 years, I've slowly become an in-house specialist in innovative public procurement. From my past life, I was very much involved in public procurement from the market perspective. And concretely in this project, I helped Roque. I was a project manager that was helping Roque with the whole execution and the whole process of the procurement.
Perfect. Well, thank you so much. So let's start now. I think it would be important to tell us about which were your roles in this project of transformation of the diabetes care model before we start with the more details of the project.
Well, as I just mentioned, I was involved from the more bureaucratic and project management point of view. I supported Roque in the whole procurement development of the tender, also all the bureaucratic and administrative aspects related to the CAT Salud call which we'll discuss later. So basically, I was the back office to Roque.
Yeah, and I was very humble and honored to lead the clinical part of the project and to make sure that we engage with the whole diabetes team and our patients and connections with all the divisions at the hospital, which are very much important to move far a project like this.
Perfect. So we are talking about demand-driven innovation. Also, everything starts from the demand side, from the need. No, so to start, maybe what was the clinical need? No, that prompted the shift of thinking. No, could you explain us which was the problem that we wanted to address?
I mean, this project actually emerged from the need, and the need was that diabetes management during the last few years has changed a lot. So technology has incorporated in the state of the art of diabetes management, and it has really good outcomes report in literature, like in terms of efficiency and in terms of security. But on the other side, it's a more expensive therapy than the ones that we used to manage in the past. In addition, our billing model with our payer is model that is somehow perverse because we are built by activity. I mean, our organization is private, but 98% of the patients that we follow, we do through the public system, and we are a non-profit organization, and the way that we are built by our payer is by activity, and that kind of system is perverse for us because it means that the worse our patients are managed, the most profitable that is for us. So if we are built by visits to ER or hospitalizations due to diabetes, ketoacidosis, or visits in the outpatient clinic. And with this kind of technology, you may be able to decrease this kind of activity. That model was not sustainable for us. So we needed a model that could somehow take into account outcomes, that could into account no presential forms of seeing patients. And that's why we decided to go into this project.
Yeah. Yeah, maybe from your side also, Luisa, no?
Well, from, let's say, the more procurement point of view, why we chose the instrument public procurement evaluation was for many reasons. On a more macro level, as we know, public PPIs they permit solving complex problems that require new, innovative, and disruptive solutions, which do not always exist currently in the market. Sometimes they do, but sometimes they don't. And so within the tender specifications of a PPI, you can require buyers to solve and to bring solutions to unmet needs which are currently not available. Also, the idea of using a PPI was also to stimulate the growth of these new ideas and to solve these specific needs, which then encourages also startups, SMEs, to be able to develop new solutions and technologies which can answer our needs. So basically, the idea of a PPI is it permits more flexible specifications within the tender. You also don't have to. You can also lower the weight of the cost, the weight of the economic proposal within the whole tender specifications. And also there is the aspect that you can include risk sharing within the specifications. And so basically, at the end of the day, it gives you a more flexible and more open-ended tender rather than using your typically public procurement means. PPI leaves you that space. It permits you to include results. It permits you to include high-value care as one of your results of the impact you expect. So it also allows you to incorporate the market within your own decision-making. So it's bringing along a whole new relationship when you talk about what I need, know what you want to buy. It gives you that freedom to open up specifications rather than I want this and this is what I need. No, it permits you to have this conversation with the market in order to find solutions to this challenge, to this unmet need that Roque specified.
That's interesting, no? But from your side, Luisa, that was your first experience in executing this kind of projects, no? And from your side, Roque, from the clinical perspective, it was the first time that you knew about this type of projects or grants that can fund, the way to solve clinical need. And how do you know the first time that this kind of instrument or new financing instrument was proposed to you? And how was your reaction? Or did you understand what was your role in the whole project?
I mean, changes are not easy. So we had to work very hard with the team, with the hospital, to let them know that this kind of change is necessary. Yeah. Otherwise, our patients cannot access the kind of therapy that they need to manage a very complex and chronic disease like is type 1 diabetes. So if you are able to explain that at the end of the day, this kind of projects, it means a lot of work, but otherwise it's the only way to move forward to get the kind of therapy that our patients need and that our patients request. I think that's from my point of view, that's the feeling that the feeling that the team had in order to participate in this project and do with their best to move forward the the project and get the outcomes.
Perfect. Wonderful. So now maybe if we think about the whole process, no, can you explain a little bit the main phases, no, the stages of the project, how it was developed a little bit, no, how it started, which sometimes starting is the most difficult part, no, engaging, starting something from zero.
I think the starting point is always, the unmet need, which as Roque said, was identified, and we realized that there was an unmet need. Coincidentally, and this is pure coincidence, CatSalut, the National Catalan Health Service, had published a call in order to finance public procurement of innovation projects. So we were able to present our unmet need to this call in order to be able to get the money to finance what would later be the tender. Okay. So once you have, once you've done this needs assessment, you've identified this unmet need, you can assure the money in order to be able to execute and to be able to publish your tender and to pay for the innovation you want. You need to do a second phase, which would be all the market research. You need to be able to know what's out there, what isn't out there, what you want. You need to assess and align the unmet need with what the market landscape and ecosystem is at the time. And then you also need, having all this information, you then need to go into a stage of developing the specifications of your tender. The development of the specification of the tender is a bit of a conversation between a market consultation and the needs that you want to be solved within your institution. So we undertook a market consultation in which you present very generally what your unmet need is. And then that's the opportunity to have you interview with all the different providers within the market that can give you a solution which is already sort of tailored to your needs, or that they can develop a solution to your needs.
And sorry to interrupt you, Lisa, in this. So the market consultation at the beginning, it's mainly focused on the outcomes of the solution, but not on the technical specifications, or how?
Not so much on the technical specifications per se, because that is what you will write in the tender. And correct me, Roque. It becomes a bit of what's understanding what it's in the market, know what options are available which can provide a solution to your unmet need. You might not know the ABCs exactly of the specifications, but they can say, well, I have this, I have that, maybe we could do this, no, maybe we could do that. So it's not so much the end result, but the process of how you want to get to your result. Okay. And you can see what's in the market, and you can see what the different providers have currently, or what they're going to bring out. No, I think it was more of a conversation, a private conversation with each current provider, and learning what the ecosystem is at the current time, and know what solutions are out there.
Yeah, and I think that the main point here is that we had a very clear idea on what we needed. And sometimes it's hard to find this in the market, especially when we talk about innovative projects. So I think that open consultation call was needed. It's absolutely needed. However, it's also very risky, because you can find that what you are really looking for is not available in the market.
Exactly.
Which would be the other option, when you don't exactly have something so clear in your mind, and you go to the market to see if they have the answers to what your problem is.
Exactly.
And then obviously the next step, once you know what's in the market, or if it's not in the market, that's where you decide which instrument you want to go for. If you want to go for a PPI, if you want to go for a PCP, if you want to go for different sorts of instruments which are available within the innovative ecosystem, in order to answer the needs that you have. Because like us, we had very clear, we knew exactly what we wanted, what our patients needed. So we knew that we could go for standard PPI, public procurement call, in which we would include innovative clauses, we would include risk clauses, we would reduce the percentage, the weight given to the economic, to the budget. And we were able to include two lists of specifications, ones which are obligatory, and then ones which are optional. And according to how much of the optional ones specifications you would that you were able to give, you would get more points or less. So
okay.
So our focus, because we had very clear ideas in what was needed from the clinical point of view, our tender specifications were just a standard procurement with innovative clauses, so PPI. It wasn't those concrete instruments which are dealing with PCPs and association.
for the
for
innovation.
innovation
Yeah.
associations, etc., which are more specifically when you don't know what you want
Okay.
and you don't know what's in the market, and the market gives you an answer to that unmet need. So it was a bit, Roque had very clear idea of what our patients needed. So
Okay. So first we did the market consultation. No, what happened next? No, what was the next stage?
that was a writing, no? That's when the hard work comes along. You have to write the tender specifications, and that's making sure that the tender specifications align with our public procurement laws. They align with the innovative and disruptive nature of the project. They align with our internal needs, and all that is a long bureaucratic process, which needs to also be approved by, in the case of your Catalan hospital, for example, which belongs to the National Health, to the Catalan Health Service. Those tender specifications need to be approved by the Catalan Health Service so that they are according to regulations, etc. And that took at least a year or so in order to write all the different, and then you publish it. You have the different stages, your first administrative evaluation, then the technical specification evaluation, then the budget, and you sort of have, all the different stages. And it's a long, for us, we're a public, private institution, and we're not used to going through the public, procurement system. It was a long and tedious, bureaucratic process, but all in all, I didn't think it didn't go that badly. No, it was.
I mean, you need to make sure that you don't commit mistakes. Yeah. Otherwise, it means delays. And in this case, are delays for providing care for people who need this kind of care. So we wanted to make sure that we were on the right way. And I think that's key. Otherwise, there are delays. Patients could be had some bad situation in this way and affect the type of diabetes care that we provide.
Mm-hmm. And Roque, how was your role in this second stage of the project? That it's more related to contracts and more administrative process, but in this kind of projects, I think that the role of the clinical champion is very relevant. So what was your role in this stage?
My role was basically to ensure that what we were detailing in this pledge was aligned with patient needs.
Okay.
That's to make sure that it makes sense, that we could ensure accessibility for those cares that patients really need, and to make sure that everything makes sense.
Okay, perfect.
Yeah, I would also add that one of the key aspects, I think, of innovation procurement is that you are essentially not paying in relation to technology or to concrete actions, but in relation to results. So the clinical champions, their role is also to specify indicators of clinical results, which then you can how do you say this? You can then pay the provider in relation to how well or not they are complying with those results. So tender specifications had minimum and maximum requirements that they needed to execute throughout the contract. How many, I'm not a specialist in this, but how much technology they had to, how many patients they had to enroll with new technology, with artificial pancreas, etc. So certain values and indicators, which the clinical champions are the ones who have to establish how, on which basis you pay the provider, and on which results, and what quality you're expecting.
Yeah, and you also need to make sure that these kind of goals are really achievable. Otherwise, it disturbs the project.
Of course, yeah. Okay, that's interesting. So, and then we did the market consultation. We launched the tender. So then I guess we review all the proposals, and how did it continue?
We evaluated everything, and then you go through you start going through all the different processes of evaluation, administrative, like I said, the technical, the economic, and then at the end you do you add everything up together, and you get the tender winner, who then you sign a contract, and then that's when your actual contract with the bidder starts from the moment you sign. And then you start working, you start co-designing the solution. The provider becomes a partner, And as Roque will explain now, they integrate with themselves within the clinical team. And that's when this new whole phase starts, which is this kind of, this kind of change in paradigm, in mindset of,
Yeah.
So
now the fun part, no, Roque, how has the model changed?
Once that the administrative part finished, it's when challenge start because first of all, we were working in this case with technological companies, and so we need to ensure that patients could have access to different kind of devices. None of them is manufactured by only one provider, so we need to ensure that these providers could agree to sell themselves products which are otherwise competence between them. So that was really a challenge. Then we need to make sure that we can integrate all data coming from different companies on the same platform. That was not easy at all, not only from the technical point of view, that we moved forward with that but also with the rules and the law that all data could be assembled in the same platform, and then we need to explain it very well to the team and to the patients. Otherwise, it's a project is not really understood. That's when problems may start one way or another.
Exactly. No, I remember the first time we talked about the project, you explained me this, no? And the change of mindset for the patients and for your team, no? How was that?
Yeah, I mean, our project basically relies on telemonitoring. And so we're able to take automatic decisions through a platform that could provide advice to the patients so that we can decrease the visits to our clinic. So if you don't explain this very well to our patients may feel that my doctor doesn't want to see me. Yeah. So you need to explain them that this is like a big brother, that we are looking forward your numbers every single day. And then if we need to intervene, then we will call you. Otherwise, we can schedule some visits and we can enlarge the interval in which we see our patients. But if you don't explain it very well, our patients may feel that their team does not want to see them.
Yeah, and for your staff, no, for the people working in your team, also, how was the change perceived, no?
Yeah, it's at the beginning it was tough, and one of the first tasks that we did was to map every process that we have in the clinic. I mean, it's very important to sort of the processes that you have in the clinic, and it's important to highlight that if we want to get different results, we cannot do what we are doing in the past. Yeah. And that sometimes it's hard because we were relying on a model of success. I mean, we were a pediatric reference center with good outcomes, but this means go forward and further. And to explain that we're going to change the way we have been working during all this time was hard if you don't really let them know that the message is that our patients will feel better, and that we also as a team will feel better, and we will generate value that at the end of the end means more time for research, more time for doing meetings, for talking within the team. So I think that's key for the success of the project.
And also for being today here with us, no?
Yeah, absolutely.
Perfect. And now, I wanted to ask you about the most challenging parts of the projects, or the most difficult part, and also which things, now that you have the experience, think that could have improved the process, no?
I think essentially our project went very well, but I think maybe if I can not change the question, but I say, what do I think are like the key aspects to success to a PPI project? Because I think we were very lucky because we're in an institution where the the key actors are very engaged with the process of changing this mindset from from activity to value, because essentially they want to impact the quality of life of our patients. So I think one of the first issues is to assure that you have an institution where all actors which participate in these processes are engaged with this change. And we are lucky because from the start, our CEO, the whole institution, it's a very top down, bottom up belief in that things have to change. Likewise, I think there is an essential need for the actual system as a general that needs to undergo certain changes in the way things are done. On the one part, the market needs to understand that they need to start working together, not only between providers, but also with the different healthcare buyers as such. There needs to be a team. If this is going to work, the market and the buyers become essentially co-designers of future solutions. But then also the system, from the buyer's point of view, has to understand that even though maybe this change from buying per technology, per activity to buying per value includes an initial increase in costs, in the long term, anything which helps manage diabetes or any chronic disease in the long term will suppose a less of a cost in the long term. So it's this change of paradigm from let's save costs in the short term to saving costs in the long term. So that at the long term, the cost of our healthcare system will be less, even though initially this change of procurement style might initially suppose an increase in costs. But I think also there's still a long way to go in the flexibility of procurement processes. I think we are still very encorseted by the public procurement law. And although, yes, we have certain instruments very dedicated and specific innovative unmet needs, I think there's still a long way that can go in flexibilizing the procurement process. And I think, like you said, I think it's very important to undertake change management, capacity building, mentoring in the whole, because it's still, it's relatively new instrument. And even though maybe we have all, most institutions have published public procurement and we think we're procuring innovation, essentially a lot of the time it's just you include innovative causes, etc. It's not exactly a PPI in the strictest sense. So I think there's still a long way to go, capacity building for education, market, change management, and helping the whole system change a bit of its mindset, towards value, towards impact, towards result, and towards solving unmet needs with new, innovative, and disruptive solutions which might not actually exist in the market.
Mm-hmm.
I fully support Luisa's message, and I highlight the issues of bureaucracy for the public tender. That was really tough. But in addition, I would say that for me, one of the main challenges is that we needed very much stepwise approach of the process. You cannot do everything at the same time. And so it means that at the beginning, you need an investment of your time to change processes, clinical processes, to all the technical issues that this project requires, like different integrations. And so at the beginning, you are not able to see any kind of results. Even you can feel that you are moving slower than you were doing in the past. And so you need to make sure what your goals are. Otherwise, it's very hard to get them. And it's interesting because now after 3 years of this project, we can review the presentations that we had at the beginning of the process. And now it's in the point where we want it to be.
Yeah.
So it's very important that you need to be patient, because the investment of time is really important to succeed in this project.
Perfect. And now after this project, in the implementation, you kind of have become more experts. You have a different level of expertise. And do you think that with the experience that you have had during this project in the diabetes, you would feel more prepared to participate in a different or in a new public procurement of innovation?
I thanks to the experience here, Sant Jose also has a Parc Sanitari, which is a mental health hospital, and I participated in the 2 public procurement of innovation projects that we have there, thanks to the experience here. And I mean, all these issues that we are talking about, they come up all the time. The engagement of the institution, the bureaucracy, the time, having very clear what you want. Well, more than having clear what you want, having clear what your unmet need is, no, and what you're aiming to have, no. In the middle, that's where the market comes up with what solutions are there for your unmet need, no. But I think that this experience has given me, along with the other two, a better view on what this innovative ecosystem and public mixed with public procurement has to offer.
Sorry.
And I believe that it's a very powerful instrument to use, which could have a lot of benefits if it's used well. And
Okay.
Sophia has become
Yes.
too emotional.
Okay, but Luisa, please, you can finish, and then we have also one question, so we can also go to that.
No,
So-
I was just saying that I think that. Yeah.
Well,
For Sophia.
I mean, I think that we are ready, but this kind of project really means a lot of efforts.
Yeah.
And I'm very happy that we have to support many divisions from the hospital. At the beginning, it was the innovation division. I see Jorge Juan over there. There are now at the beginning, but you need to make sure that you are supported by the different divisions of the institution. Otherwise, it's not possible. It's not possible because it means that you will need support from the legal part of the hospital, from the research foundation of the hospital, with all the administrative tasks and the public procurement and the IT division. So, and it's important to make them understand what this project is about. Otherwise, it's very disruptive of what we have every single day, and the support is only accomplished if you can explain what you have. So I think that for me, the main learning this project is that you need to explain it very well to your team and within your institutions to move forward.
Sorry for that.
We have one question in the
Perfect.
chat.
Yes. So yeah, let's go. Olman, no? We have a question from Olman.
Yes.
We're gonna read it through the chat. So the question is, how has the follow-up process of the adoption of the innovative solution after the project has ended? No, is it still ongoing? And what's the sustainability model for the hospital and for the innovation provider? Has there been new types of negotiations with the Catalan public payer?
I mean, I think that this is the goal question. And
Thank
this,
you, Olman.
yeah. And so what happens when this kind of project finishes? So unfortunately, I have to say that the project is not finished. I mean, we have finished with our grant. However, what we have is set up continuity of this project for the future. It means dialogue with our payer, and this is already done. And so we are now projecting extension of this. I would not call it project at this time, but this process, we have project an extension of 4 more years with more ambitious goals to increase even more the access to technology. And we, at the same time, are getting prepared for other potential diabetes new therapies that for sure will be very expensive. And this kind of model prepares us to adopt this kind of new therapies in a better way.
Totally makes sense. Yeah. Jorge,
yes.
yeah, you can join the discussion. You also have an important role in this, no?
No, yes, I'm sure not at all. It was Roque and the team. But no, I have a question too, and it's good to see projects delivering value, which is always great. Okay, no, but I have a question to Luisa because I'm interested in the or to everybody. Let's say I'm interested in all because there are, let's say, there are many venues to innovation into the healthcare system, right? And there are different tools, some of them available from the government, some of them available from, let's say, the European Union, different ones, right? You've mentioned a few of them, But in your experience so far, what are the tools that you have identified, and how would you rank them? Let's say, right? So let's say if you, it's a very opinionated question. You can, every answer is going to be right or wrong. But if you let's say, if you can say, okay, I will always do X and will always avoid Y, what would be your take, Luisa? And also, Roque, you can participate as well.
That's like the most open-ended question ever.
Indeed.
I think it depends on what the starting point is. As you probably know, the different instruments can be ranked apart from the ones you mentioned. How close or not you are to the market. So if if you can be in the development stage, or you can be closer to the market stage. So you can choose or PCP or PPI or Association Association.
Innovation.
Yeah, it comes in Spanish. In English, it's Innovation Association, or competitive.
Say it in Spanish. How's it say?
Yeah, so Innovation Association, no, Asociación para la Innovación is one of the instruments, which the actual
Innovation Partnership. Yes, is Olman.
Okay, Innovation Partner. Thank you. Which the public procurement system includes specifically, along with competitive dialogue for innovation procurement. I think it depends very much on which the starting point. In-house, we have done your standard PPI, which is this one we have, which we did for diabetes. In El Pac Sanitari, they were also standard PPIs, but we also did PCP, which I think due to the impossibility of the market being able to respond to the needs of what the clinicians wanted, or what the clinicians wanted wasn't able to be responded to by the market, the end result was not adopted. So our experiences with PCPs in-house haven't been very positive if you include a positive result, the adoption of that innovation. Maybe the process in C bureaucratically wasn't bad, but if you consider that the innovation end product wasn't adopted, then I would say that it wasn't a positive result as such. Whereas our PPI, our standard PPIs, because we had very clear what we wanted, have been successful in the 3 cases. The 3 cases, the technology or the service have been adopted. Our experience, personal experience, would be this, because they weren't that open-ended. I think the personally, and this is from our personal experience here in San Juan de Dios, the more you open up, or the more undefined or unclear you have your unmet need or your desires in your head within the demand side, I think it becomes more complicated, because it's especially the big, large consortiums. Our PCP was a huge consortium, and it wasn't, the different buyers didn't agree on the different solutions. It was very difficult to have one clear solution between all the buyers. So I think for us, what we have done here would be our top. Also, we did this collaboratively with a public hospital, and between the two institutions, there was also a very different adoption process. So I think it's depends very much on what your starting point is and how clear you have your unmet need or what you want. And depending on that, you can go one way or the other. But for us, we chose this, and I would go with this one because, it's been very positive for us in the 3 cases we have done, whereas the PCPs that we have undertaken and unfortunately haven't come to good, haven't been adopted, essentially.
Very good.
It's because of all the different inputs.
No, very good. I appreciate the insights, because I was having lunch with a friend the other day. He was telling me that the PCPs, specifically when you're talking about digital health solutions, they are not great, because by the time you get to the point, a lot of the things have happened in the market, let's say, right? So you put a lot of work, and then specifically in, let's say, in areas where there's a lot of technology coming in, once you get to the end, it's stupid, let's say, right? So it's interesting what you say.
We had that problem here as well. From when we initiated this project in 2000, by the time we were writing the specifications, technology has changed. So we included a clause within the tender specifications that if new technology would come into the market, that the provider would have to include that within the cost of of the service, because exactly innovation is not it's not how do you say, it's not
static.
static. Exactly. It's, that's the whole point of innovation. It changes. It is always changing and fast, especially nowadays. So that has to be included. And I think also in PCPs, it's usually not one institution that participates in a PCP. So aligning all the different participants of a PCP is very difficult, because at the end of the day, everyone has their own needs, and essentially the basic need could be the same, but what each clinician, each clinical champion has in mind doesn't have to be the same. And at the end of the day, you want one solution, and you end up with one solution which is a minimum common denominator between everyone, which sometimes doesn't respond to anyone's needs. So
Such a great insight, Luisa. Very good. Thank you for that.
Thank you. And we have time for our last question from Marta, from our colleagues from Riga, no? And the question is, how did you reach potential providers during the market research?
I mean, we did an open market consultation, and so we were actually expecting diabetes companies that they were willing, that they already, they actually went into this consultation. However, the majority of diabetes companies were showing their diabetes products, and this project is beyond the diabetes products. I mean, it's of course diabetes products that have improved very much during the last few years, especially those aspects related to artificial pancreas. And we wanted to make sure that we could include in the tender all the specifications and all potential innovations in this way. But it's also about the service, and there were companies that ran into the open market consultation that had nothing to do with diabetes, and so they were providing the service. So actually, the solution that we finally was awarded is a diabetes company. However, they own also a specific company which does not build diabetes products, but provides service. And actually, I mean, I think that the added value of our solution is the service. I mean, the products are already used in other parts of the world, in other hospitals, but the solution is what makes this project unique and affords us to use the diabetes technology that, as I mentioned before, it's the expensive one.
we were expecting a few more providers to respond to the call, maybe like consortiums, because like Roque said, because it's not what we want is a service, we were maybe expecting consortiums made up of a service provider and a diabetes technological provider. And that's where I think the market still has a long way to go in order to create this change in which the market speaks to each other, and you create consortiums where you can provide the solution together. And we knew that there was talk that there were going to be some consortiums, but at the end there weren't. But I think the market still has a bit of a way to go in order to collaborate more together.
Yeah. So one of the main issues that many of these companies are international companies. So they have international headquarters that do not allow the cooperation at local level, even though that people from this company at this local level would be willing to collaborate. And so this is some kind of the issues that we found during this project.
That's interesting. Well, I think we're running out of time. And I think we had a very nice discussion. Thank you all for joining today. Thank you, Roque and Luisa, for coming today and sharing with your experience with us. And before we close the call, we just want to share a couple of next events that we're gonna have in the IFOTIPS. So first of all, the celebration of the Pediatric Innovation Day in Barcelona on the 21st of November. We are still closing the agenda, but I promise it's gonna be with amazing context. So please, you can start registering for the event, and we'll be in Barcelona at the Cosmo Caixa venue. And also the next training capsules that we are publishing through the IFOKids Europe. You have the link to register. And the next one will be on global best practices in pediatric patient experience. And last but not least, in the frame of the AdvoKids project, which I briefly introduced at the beginning, our partner Aguas is organizing a series of events. Now we are about to close the agenda for the feedback event. So here you can find also information on how you could collaborate. And we need insights and experiences from different stakeholders. So we would really appreciate your contribution on that. And yeah, I think that was it. Thank you very much for joining today. Thank you for your time. And obviously, thank you to Luisa and Roque for coming today. And hope to see you soon in the Pediatric Innovation Day. Bye.
Thank you.
Bye.